Most women take preventative measures when participating in various activities and taking care of others. They wear a helmet when biking, they make sure their children are strapped into a car seat or have their seatbelts buckled, and they get their flu shots. But an overwhelming number of them do not take the time to get their annual screening mammogram.
I came to the breast center to get my first mammogram because I turned 40 this year, and 40 is the recommended age for women to start getting their annual mammogram screenings.
Statistics show that locally, there is an overwhelming number of women who do not get their yearly mammograms after they turn 40. The CAMC Breast Center is a facility that provides all aspects of breast care in one place, so walking through the door for a first-time mammogram is easy.
I don't really have any fears about having a mammogram. It's an annual screening, it's pretty routine. I've heard all the horror stories about mammograms, but surely it can't be that bad. I can let you know on the other side, but I feel that having a mammogram would be far easier than enduring breast cancer. And a mammogram is the key to detecting breast cancer early, and I'm going to do everything I can to stay healthy for me and for my family. So I'm going to get my mammogram every year because if I'm going to encounter breast cancer in the future, I want to have the best chance of beating it. And the best chance of beating it is to have my annual screening.
Amy Beaver, breast navigator at the center, walks us through a typical visit.
First of all, you'll enter the breast center and sign in at the front desk. They'll be taking your name and your birth date and giving you some paperwork. The paperwork consists of vital information that they need, risk assessments. We need to know family history, the date you started your period, did you breastfeed, when was your last annual clinical exam. It's very important to combine your clinical exam with your mammogram because the mammogram only picks up things that can be seen on x-ray. There are things that can be felt that aren't seen on x-ray, so it's vital that you have both of those done every year. They'll have you have a seat in the waiting area, then you're called in by registration to get registered and get your armband. From there, they'll be taking you to sub-waiting where you'll get into your gown. You do have to undress from your waist up. You will remove your deodorant. Deodorant has aluminum, which can show up in the x-ray and look a lot like calcifications or artifacts, so we like for you to remove that as well. Then you'll be taken into the mammogram room where your technologist you'll be seated and you'll do an interview with her, and she'll enter all the questionnaire information into the computer. And then she'll have you stand at the console of the mammogram machine, and you'll have your mammogram at that time. It's very quick. Compression lasts about 3 to 4 seconds per picture, and usually it's 4 pictures, 2 per breast. And then she'll review the films before you leave to make sure that there's nothing wrong with the films, and then you'll be able to leave.
Yearly mammograms, along with a yearly clinical breast exam and monthly self-breast exams, are the gold standard in finding early-stage breast cancers. Finding the cancer early increases the patient's treatment options. A yearly mammogram is important because it can demonstrate an abnormality that is not detectable by examination.
You'd be amazed people who want questions about self-breast exams. How do I examine my breast because they don't know? That's something we don't teach at a young age. We don't teach our children, we don't teach them in school about breast exams. So if gynecologists don't do that, ladies are nervous about touching their own breast, and what am I going to feel? Because breasts are lumpy. So if you feel your own breast, you're going to feel lumps, and then that scares people if they don't know what the normal breast feels like. So our technicians will take time to discuss self-breast exams, what to expect, what to report, who to report that to, those type of things.
Women need to be aware that family history of breast cancer is not a good determinant of whether or not they should have their annual screening exams after 40.
We hear people say, I don't have a history of breast cancer in my family, my mom didn't have it, I'm probably not going to get it, when statistically inherited breast cancers only make up about 10% of all breast cancers. Majority, about 3/4, are what we call sporadic breast cancers, which are just potluck cancers. We don't know why patients develop them, but they do. It's not linked to a gene or a mutation or family history. So it's important, with or without a history, to have those mammograms. Now, if you do have a family history, you can be considered high risk. Probably need to start your mammogram sooner than 40. Usually 35 is a baseline. Or rule of thumb, 10 years prior to your mother's diagnosis or your sister's diagnosis. So let's say they were diagnosed at 40. At 30 is when you need to start imaging.
At the breast center, Beaver emphasizes screening.
We do it for early detection, so we can have early intervention, so we can get people to survive the stuff that they haven't been surviving. And we're there with breast cancer. You know, we've had a 30% decrease in breast cancer-related deaths since 1990, and it's directly related to early detection. You can't prevent breast cancer. We don't have a vaccine for that right now, but if we can detect it early, we can cure it, and that's the goal, is to get these patients to survive.
If an abnormality is detected during a breast exam or mammogram, the breast center is structured around a team of physicians, nurses, and technologists who are specialists in breast diseases. The breast center provides a number of programs that range from different types of imaging to quick access for the diagnosis and treatment of any breast problem, including patient navigation, breast risk assessments, genetic testing and counseling, and rapid referrals to breast surgeons within 24 to 48 hours and other disciplines. The breast center is designed to provide a solution to all breast concerns in a matter of days. What is a first-time mammogram like?
My first mammogram, it wasn't bad at all. I'll get my results back in about a day, and if I would need further testing or if I would need any kind of care, I'm comforted in knowing that the breast center is exactly where I'd want to be. They have the best technology, they have the best staff, and if I ever would have to face breast cancer, I know I'm in the right place to treat it and survive it.